tech, and I like to consider myself a superhero with superpowers. I have the ability to see broken bones, obstructed bowels, and even the functionality of your swallow. Here, I'm just trying to open up and give you kind of a little bit of a tutorial on what exactly we all do, because it's definitely a rewarding field to get into. Going to explain to you a little bit of the process of getting into a program to become certified and become an x-ray tech. Some of the different examinations we do other than just taking pictures of your bones, and then some of the modalities you can get into once you become an x-ray tech, because it definitely opens up the field. So first and most important, you need to find a program. I went into the FSCJ program, which is highly competitive. They only accept 30 people a year. Once you get in, the dropout rate is pretty significant, because I think that a lot of people don't understand the vast amount of things we do. But once you do get into a program, you have to make sure that you have all your prereqs, which give or take you probably have like 5 to 6 prereqs. A lot of them is human anatomy, with labs and whatnot, medical terminology. And then once you also get in, you want to make sure you're financially stable, whether you get loans or grants or whatever you want to get, because just by itself, this one book with the whole packet is about $600 for one semester. So the books that we have to get are very, very, very expensive, and they definitely come in handy, but very, very expensive, and trying to work during all this is very hard. So you want to make sure that you have financial aid or some sort of stability while you're in the program, because you're going to need it. And once you get into the program, it is a 2-year program. It's highly, 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 it's strenuous. Like, you're working all the time, and then in clinicals, and then while you're in clinicals weekly, you're also doing class. So the only time you really have to work is on the weekends, and that could be very, very stressful whenever during the week you're in the hospital, and then you're studying and you're trying to keep up with your grades and everything. It's very hard once you're in, but it's definitely worthwhile. So once you get in, like I said, it's heavy on your shoulders. But some of the things we kind of do, a lot of people don't understand once you do get into the program and you start working in clinicals. We do more than just x-raying bones. Like, we don't just sit there and take pictures of bones all day. We also, we work with fluoro, which is fluoroscopy. It is live video feed. So what we'll be doing is 2 of our main exams we do have to do with your digestive tract. So we will watch you swallow, we will give you contrast, it'll light up in our machines, we'll watch you swallow, and then we'll also kind of track it through your digestive system. So either you'll be swallowing contrast, or we also do inject it anally, which a lot of people didn't realize we do that. And I think that's probably why a lot of people drop out of this program, because it is a very personal profession. Like, we have to be around people, and nudity is a huge thing, and it can be a little gruesome sometimes. But it's definitely worth it. So we'll be watching your digestive tract. We'll watch how things kind of work, make sure everything's okay, make sure nothing's perforated and leaking out. And then we also make sure there's no obstruction, like if you're constipated or if your intestines are just really, really tight. Well, that's something we find out ourselves. So that's one of the exams we do with fluoro. One of the other exams we do is we do orthograms, which kind of guide needles into your joint space between bones. This is kind of used for people that have arthritis, so that kind of works with that. Either we'll do cortisone to help with the pain, we'll do in your elbows, shoulders, hips, knees, wherever the pain is at. We also inject contrast for MRI or CT, so we use our machines to guide the needle to make sure that we're in the right spot, inject contrast, and then we'll send them to CT, MRI, whatever needs to be done. And then we also do that with your spine as well. It's called a lumbar puncture. So we could do that. We use our fluoro machine, and we'll have a doctor come in, guide the needle into your lower back, just about right here, right below your spinal cord. Make sure that we're low enough so no one becomes paralyzed or anything like that. And we'll take out fluid to test it, there's many reasons why we do all these things, but these are just a little bit of the things that we do that people aren't really aware that an x-ray tech does, which is very eye-opening, but also makes the job way more fun. Something else we do, we also do a lot of ER and OR instances. In our ER cases, like if someone has a broken elbow, for instance, and they can't fully extend it, we have to think outside the box. So what we would have to do is, once we see that broken elbow, we would get a distal humerus and then a proximal forearm. You know, it's a lot of thinking outside the box. So it's not just something as easy as just taking a picture of an elbow. Sometimes it's very challenging, and it requires a lot of thinking out of the box. Another reason why it's kind of a challenging career once you get in, because people don't realize this, but it's definitely rewarding once you get in to see and help all these people. And like I said, you're kind of like a superhero at this point, because you're looking at all these different bones and you're like, oh, okay, like I can help you, and it's awesome. So there's definitely a lot of pros to doing this type of work. But lastly, once you kind of get into the field, once you kind of get past all the prereqs, get past the strenuous workload and all the studying, and then you get in and kind of get your hands on everything we do, is, like I said, it's very rewarding, but it's also a step in the door. If you decide later on down the road that x-ray isn't something for you, you can go into like MRI, you can go into CT, you can go into ultrasound, you can go into nuke med. There's so many different opportunities past x-ray, and all you need to do is pass your board, which is your ARRT board. And once you get that, then you can go into all these other modalities. So it's definitely, like I said, very rewarding if you can get past the student phase, if you can get past all the things we do. Like I said, working with your digestive tract, it can be pretty gruesome sometimes. For example, one of my worst stories ever is if I've had someone actually like puke up their own feces through their mouth. So we do see kind of gruesome stuff, but like I said, it's highly rewarding. I would definitely recommend doing that. And like I said, later on down the road, if you decide that x-ray isn't for you, you can go to so many different modalities. But just kind of like a recap on all of this, the program, highly advanced, and it's kind of hard to get into depending on what program you get into. Like Kaiser is very hard. FSCJ only accepts 30 students a year, and you want to be sure to have all your money saved up to do this. And it's a very strenuous workload, so you wanna study a lot. Once you're in, the course load it's strenuous, like I said, and we do a lot more than just taking pictures of bones, that for sure. But you could definitely advance and go into any other sort of field whenever you do that. So it's highly rewarding, and I just want to stress how great of a program it really is. And I hope that anyone watching this, I might persuade them to do this, because it's definitely rewarding. So I hope you enjoy.